Let me welcome everyone to the first meeting of the Subcommittee on Health of the Senate Finance Committee of this Congress. I want to thank Senator Wyden and Senator Crapo for their cooperation in the establishment of the subcommittee and our ability to hold hearings. And Senator Daines, I want to thank you for your help and cooperation. I look forward to working with you. We have obviously a very important agenda, and I hope that the subcommittee will be able to do some oversight as to some of the issues that are pretty pressing in our healthcare system during this Congress. I look forward to working with you, and I am very pleased that Senator Stabenow is here. Senator Stabenow has been one of the great leaders on healthcare in the United States Senate, and she served with great distinction as chair of this subcommittee. So I thank her for her help. I know of no subject that she has been more active in than on oral health care. She's been one of our great leaders in the area of oral health care. So today's subject is the oral health care crisis, the need to address disparities. Disparities in our healthcare system are well documented, and the impact it has in regards to vulnerable communities. With the passage of the Affordable Care Act, we elevated the Institute for Minority Health and Health Disparities as a full institute under the National Health, NIH, and they have documented the disparities based upon income. Lower income communities do not have the same healthcare providers in their community as we see in other communities. They've documented in rural America where, there's not as many healthcare providers. We've documented disparities based upon race and ethnic because, again, there's not as many providers in regards to the workforce. So we have documented a lot of the reasons for disparities in our healthcare system. And it is very prevalent, the disparities as it relates to oral health care. And it really came home to me when I was first elected to the United States Senate in 2007. Many have heard me talk about DeMonte Driver, but I'm going to mention one more time. DeMonte Driver was a 12-year-old, lived in Prince George's County, Maryland, about 7 miles from here. He had a tooth problem. His mom tried to get him help, but could not find a dentist to take care of his needs. She tried several times and was unable to get any help. She fell through the cracks. She wasn't in the Medicaid system at the time, and there were some eligibility issues, but she didn't have any reimbursement. And DeMonte ultimately became very sick, rushed to the hospital, had an impacted tooth, went through 2 operations, and what would initially have cost $80 for a tooth extraction ended up costing hundreds of thousands of dollars, and tragically, DeMonte Driver lost his life. So that really struck home that a person in my community that I represented, that we could have that type of an outcome. Now, it led to some changes in healthcare policy, working with Senator Stabenow, working with my dear friend Elijah Cummings in the House. We were able to extend pediatric dental under both the CHIP program and the Affordable Care program. So we were able to make some progress, but there's still many gaps today. Oral health is integral to overall health and well-being. It can make worse an underlying health condition and impact affecting overall health care cost. It can impact a person's ability to get a job and be well enough to work. It impacts a person's ability to go to school, affecting the local and national economy. It can impact a person's confidence and ability to enjoy life or communicate effectively, affecting communities and overall society. Despite the importance of oral health, millions of people in the United States are getting the care they need, or not getting the care that they need, excuse me. Former U.S. Surgeon General David Satcher said more than 20 years ago that you cannot be healthy without oral health. Certainly, we have made progress in improving oral health for children since then, especially for vulnerable children. But for working-age adults and seniors, disparities in oral health outcomes and in access to dental care have widened by income and race. Treating dental care as an essential in U.S. health policy for all ages, not just children, is the only way that we can address these disparities. The oral health crisis is costly, and taxpayers are paying for it. Through worse outcomes for people with diabetes or heart disease worse pregnancy outcomes, and through emergency room visits, we are paying more in our healthcare system as a result of these disparities. One study found that the U.S. could save over $22 billion annually by improving oral health care. This is not a partisan issue. During the Trump administration, the U.S. Surgeon General and NIH began working on the report that became Oral Health in America, Advances and Challenges, which was released by the Biden administration in 2021. This was a follow-up to the landmark report of 2000, Oral Health in America, a report of the Surgeon General, which provided a comprehensive look at the importance of oral health and the disparities in the United States. I have been pleased to work with the Biden administration to advance a number of oral health priorities, including the historic appointment of Dr. Natalie Chalmers to be the Center for Medicare and Medicaid Services Chief Dental Officer. That position lay vacant for many years. We finally got it filled, and we're very pleased that we have that position in order to put a focus within HHS on oral health care. And at the beginning of this year, Maryland Medicaid began covering adults. However, 16% of Maryland residents are over 65 years of age. And approximately 626,000 people in my state and more than 70% of the seniors in Maryland do not have dental health insurance. We have gaps that we need to deal with. To echo the former U.S. Surgeon General, C. Everett Koop, there's no health without oral health. Adequate access to oral health is essential to preventing tragedies like the passing of DeMonte Driver. I hope we can work together to try to narrow the disparity gaps that we have and find ways that we can deal with the healthcare crisis.